Hi, I'm Samantha Mango. Welcome to Sullivan 180 Presents Take 5. Our guest today is Dr. Bruce Ellsweig, family physician at Crystal Run, the medical director for Sullivan County Public Health, and the medical director for Tri-Valley School System. Welcome, Dr. Ellsweig. Thanks for being here.
Thank you very much for having me.
How are you?
I'm doing well. Being challenged, of course, by what's going on.
I'm
But
sure.
certainly doing well.
Can you please introduce yourself and give us a brief description of your roles at Crystal Run, the county, and Tri-Valley School System?
Absolutely. I'm a family physician, board certified in family medicine and also in palliative care and hospice. I practice at Crystal Run and seeing patients on a regular basis. And I am the Sullivan County medical director for public health. I also help with the Tri-Valley School District as a medical director as well. And I see patients on a regular basis for all types of diseases from birth until death as a family physician. And I have a passion for taking care of people at the end of life as well.
That's great. Thank you so much for the work that you do. I want to talk a little bit about the COVID-19 vaccine within Sullivan County specifically. The vaccine statistics are quite low compared to the rest of New York State. Can you talk a little bit about why it's important for residents in our county to get vaccinated?
Absolutely. The only tool, the best tool that we have to prevent the spread of COVID-19 and to prevent the mutations that occur, such as the new Delta variant, is to have the majority of people vaccinated. That's our purest and best protection. 99.9% of people that are vaccinated don't have the issue of severe disease or hospitalization or death. So that the vaccine is a safe and appropriate tool to help stop this horrible disease from spreading all over the country. And certainly we need to be more aggressive in getting people vaccinated in Sullivan County.
And a lot of people are hesitant because they've read stories or received what they think are facts about the vaccine. Can you talk about what some of those myths are and what the real facts are about the vaccine?
The major fact is the vaccine is incredibly safe. There have been very, very few complications from getting the vaccine. Some time ago, there were some issues that were made public about the J&J vaccine, but the number of people that were affected had a lower risk than getting struck by lightning and being injured that way. Some people get achy after the shot. Some people get feverish and feel a little uncomfortable. And many people get a sore arm. But no different than getting any other vaccine, such as the flu vaccine, the diphtheria, tetanus, pertussis vaccine. This is a wonderful tool, and it's been far more successful in preventing disease than many of the previous vaccines, despite the fact that it has been the turnover time to creating this vaccine was remarkably fast. And it's a totally new technology. The mRNA technology is a wonderful technology. It's been developed over the last 10 years as an option for developing vaccines and treating a myriad of diseases. And the problem we have is that an unimmunized population is a petri dish. It's an opportunity for the virus to mutate and create new variants that, as the Delta virus is much more aggressive, much more likely to kill people, much more likely to spread, and unfortunately, it's much more likely to infect and cause horrible complications for young people. Many people were under the impression that if you were under 30 or under 40 or a child, that you weren't going to get severe illness. But that's not the case with the Delta variant. And it's not just the illness that you get at this time, it's the long-term consequences that happen with COVID, from PTSD to anxiety and depression to loss of taste or smell that goes on for months, to persistent fatigue and shortness of breath, chest pain and chest tightness, persistent cough, brain fog, memory problems. The disease is insidious. And even though that you recover from the severe illness, and even if it's a mild illness in many people, you're left with the long haul symptoms many times, which can go on for years. There are other myths out there that it'll affect pregnancy or fertility, and this hasn't been shown to be true. It's been proven to be safe to give to pregnant women. It's been so far proven to be very safe to give to 12 and older children And we have to deal with the people who are underserved to make sure that they have adequate access to the vaccine and making sure that they don't act as a growth opportunity for the virus. People are afraid that this is an experiment, that this has something to do with the government or politics, and it does not. This is a deadly disease that's worldwide. As of today, 70% of the people in this country have been at least received one vaccination, which is a wonderful milestone. But we also have data that shows that some people who have gotten their first vaccine have not come back for their second dose.
Right.
And particularly in the children, I know that in the school district, we offered it for 12 and above, and not a lot of people took advantage of the opportunity to get the vaccine for whatever reason. I can reassure parents and adults that are hesitant to getting the vaccine that it is safe, and it is so very important to get it.
Where and when can people get the vaccination currently?
Most pharmacies offer the vaccine. It's free. It's available. Most health centers offer the vaccine, again, free and available. At Crystal Run, we are open Wednesdays for vaccinations for our patients. And all you have to do is schedule an appointment. You can get online with the state vaccine hotline and find out the nearest place to get the vaccination from where you live. I know that you're doing an outreach to get to people who can't get out, and that's a wonderful opportunity. And public health also is going out to the homebound that are our patients and distributing the vaccine that way. And I still encourage people to wear masks, particularly in public settings, because you don't know who you're going to confront who hasn't gotten the vaccine. And since we know that even vaccinated people can harbor the virus and spread it, masks are still important.
On that note, is there anything else that you'd like to share?
Just get vaccinated, wear a mask, be careful. If you have a symptom, even if it sounds and feels like the common cold, get tested. That's the other thing that we don't do enough of, is getting people tested, because the true data, the true amount of disease that's in the county or in the state or in the country is still unknown, because we don't test enough people to find out how many people have the virus or harboring it, even with no symptoms or few symptoms.
That's important to note. Thank you so much for your time. Thank you for all you do in the county and for helping us and the rest of the community stay safe and healthy.
Thank you so much, and thank you to Sullivan 180 for everything that you do to improve the health of the county.
We appreciate you.
My pleasure. Anytime.